So let me talk about the anticholinergics. So anticholinergics are the drugs that blocks the action of acetylcholine. In this picture, we can see acetyl-CoA converted to acetylcholine. And acetylcholine is a neurotransmitter or a chemical messenger. It transfers the signal between certain cell to the affect how your body function. So this is the one nerve ending, another nerve. So the acetylcholine release from this cell, and then there are receptor, they can get inside the another cell and they transmit the signal. And anticholinergic can inhibit or blockage the function of acetylcholine. Anticholinergics can treat a variety of conditions, include urinary incontinence. These anticholinergics inhibit the parasympathetic nerve impulses by blocking the action of acetylcholine. What are the drugs name we use as anticholinergics? The most common drugs we use are atropine and ipratropium bromide. Right? What are the other medication commonly used? Like dirifenacin, dicyclomine, oxybutyrene chloride, or we use the propenthelin and tolterodine or tospriam, right? So out of all, mostly use atropine as an anticholinergics. They're blocking the action of acetylcholine. And another generic drugs named ipratropium bromide. When you give ipratropium bromide, they have a most common side effect. Also, the atropine have a most common side effect. The NCLEX board frequently asks the question that we are going to explain now. Here we showing how anticholinergics work. The effect in the eye causes blur of vision and dry eyes. Mouth, dry mouth, bowel causes constipation. Over the skin, flushing, unable to sweat, means dry mouth, blur of vision, photophobia, and bradycardia. In the brain, drowsiness, dizziness, confusion, right? So as a healthcare provider, this medication can cause drowsiness, dizziness, confusion, or hallucination. We educate our patient when they take this medication, use some precursor with driving or operating heavy machineries or performing other hazard activities. And it is good you tell your patient to avoid ethyl alcohol if they take anticholinergic like atropine or ipratropium bromide. Over the heart, the rapid heart rate. Over the bladder, urine retention, right? Retention means unable to empty your bladder. anticholinergic effect. So what are the other side effects? Other side effects, they can cause anorexia or GI upset like nausea, vomiting and dry mouth, confusion, constipation, decrease the sweating, dizziness, drowsiness, dry mouth, and also can cause gastric distension, headache, tachycardia, and urinary retention. Easy way to remember: A, anorexia; B, blur of vision; C, confusion, constipation; D, for decrease the sweating, dizziness, drowsiness, dry mouth. In a short, I left in a box NCLEX tips. Anticholinergic effect, right? Most common. Anticholinergic means atropine or ipratropium bromide. They can cause dry mouth, cannot split. They can cause urinary retention, cannot pee. They can cause constipation or constipated, means cannot poo, and blur of vision, cannot see. So easier to remember: dry mouth, blur of vision, urinary retention, constipation. Also, you have to know they can cause photophobia and tachycardias. Next, what are the nursing consideration? Right? So nursing consideration, especially extended release capsule. Most of anticholinergic extended release capsule should not be split out, should not broken or crushed out. Especially the tolterodine should be used with some precursor in the client with narrow angle glaucoma. So they worsening the narrow angle glaucoma. Not only this, ipratropium bromide also worsen the narrow angle glaucoma, or called mydriasis, means dilatation of the pupil. And oxybutyrine should not be administered to the client with known hypersensitivity or gastrointestinal or genitourinary obstruction, glaucoma, or severe colitis or myasthenia gravis. Not administered. And propenthelin is not administered the client with a narrow angle glaucoma, as like ipratropium bromide, as like tolterodine. Also, if patient has obstructive uropathy, gastrointestinal disease, or ulcerative colitis, we do not give the propenthelin. What to educate your patient? This medication can cause dizziness or drowsiness, right? So educate them, avoid the hazard activities, like also they need to use precursor if they're driving or operating heavy machineries. And also it is good to avoid with alcohol. What next? If your patient take anticholinergic like ipratropium bromide or terifenacin or atropine, it is important monitor intake and output. If the patient complains the dry mouth because they have a common side effect: dry mouth, blur of vision, photophobia, tachycardia. Because this medication decrease the salivary gland secretion, and patient complain the dry mouth. If they say about the dry mouth, provide the gum or hard candy. NCLEX asks this question. Also monitor for the sign of toxicity, especially central nervous system toxicity, such as hypotension, hypertension, anyone, confusion, tachycardia, increase the heart rate, flushing or red face. So cutaneous blood supply increase, particularly in the face, sign of respiratory depression, nervousness, restlessness, hallucination, also irritabilities. So if we see any sign of toxicity like this, we could contact with the healthcare provider. And keep it note, this medication causes mucous membrane to become dry, and tell your patient take with a full glass of water. Anticholinergics. Here, what other tips? Antispasmodic or in medication used to treat antispasmodic medication used to treat overactive bladder or urge incontinence, and should not be used the client if they diagnose with open angle glaucoma. This medication will block the flow of intraocular fluid and raise the intraocular pressure inside the eye, and they may cause permanent damage the optics nerves. Here I want to tell you two more points about atropine. Atropine, it is good to avoid with hepatitis, or if patient have a glaucoma, or if patient has a gastrointestinal obstruction or decrease the liver or kidney function, it is good to avoid the atropine. And also dairy, this one, derifenacin, we use in overactive bladder. Derifenacin have a common side effect. They can cause blur of vision or decrease the sweating, that is lead to overheating. So now let me talk about the cholinergics. So now cholinergic drugs, right? So cholinergics are the drugs which is produce the action similar to that of acetylcholine, either directly interact with cholinergic receptor or by increasing availability of acetylcholine at the site. So we call cholinergics drugs. They work similar like acetylcholine, and acetylcholine is a neurotransmitter. The cholinergic drugs we categorized into two groups: cholinergic ester and alkaloids. Cholinergic esters included acetylcholine itself, or methacholine, also betanicol or carbachol, and alkaloids muscarinic or pilocarpine. So acetylcholine or betancol most commonly used, and pilocarpine used as alkaloids. Here I left some of the medication usually we use in pharmacology. Cholinergic drugs like physostigmine, neostigmine, pyridostigmine, or doneprazil. NCLEX asks a common question: benzotropine. Benzotropine is an anticholinergic. They blocks the action of acetylcholine. Benzotropine we use as an anti-Parkinson medication. NCLEX board frequently asks this question. Another cholinergic drugs like bethangol is a cholinergic used to increase the bladder tone and function and treat non-obstructive urinary retention or neurogenic bladder. Neurogenic bladder can be caused by the brain, spinal cord, or nerve problems. So this is the urinary bladder. Urinary bladder supply by the nerves from brain, spinal cord, or the local areas nerves. So if the any problem in the brain, spinal cord, or nerve locally supply area, as a result, the bladder does not fill or empty correctly, and patient develop the neurogenic bladder. Neurogenic bladder patient urine does not control, like incontinence. So about the cholinergic drugs, what are the nursing consideration? Administer on empty stomach or 1 hour before or 2 hours after the meal to less the GI upset like nausea and vomiting. The nerve administered by intramuscular or intravenous route. We monitor intake and output, monitor for increase the bladder tone or function, monitor for cholinergic overdoses. Means excessive salivation, excessive sweating, involuntary urination or defecation, bradycardia, or severe hypotension. We call cholinergic overdose sign and symptom. If we see anything like this, we notify healthcare provider and we immediately stop the medication. And also have a atropine sulfate supposed to be ready for IV or subcutaneous administration to stop the cholinergic overdose. Cholinergic such as bethangol chloride is not given to the client who has a urinary stricture or obstruction. Here, if picture, we can see the cholinergic adverse effect or overdose effect. In a short, excessive salivation or excessive tear or lacrimation, that is secretion of tear, especially abnormal amount, or excess urination, inability to hold urine in a bladder due to loss of voluntary control over the urinary sphincter, and also involuntary passage of urine, excess defecation, abnormal discharge of feces, What are the other side or adverse effect of cholinergics medication? Like headache, hypotension, flushing and sweating, increased salivation, abdominal cramping, nausea and vomiting, diarrhea, urinary urgency, bronchospasm, and also transient complete heart block. Most of the sign or adverse effect opposite of anticholinergics. Here we can see the cholinergic agonist, salivation, excessive saliva, excessive sweating, we call diaphoresis, nausea, GI hyperactivities, means diarrhea or too much defecation, meiosis, and also urinary urgency, or patient develop incontinence. So what are the names of cholinergic drugs? I said acetylcholine itself, or bethanchol, pilocarpine. Other medication we use physiostigmine, neostigmine, pyridostigmine, or doneprazil.